All right, good afternoon, everybody. Good afternoon. It's great to be here at Cook County Health. I am grateful to our commissioners and all of the organizations that are here today representing the 53 Stronger Together grantees. 53. We're joined by Commissioner Anthony Casada and hopefully soon a representative of Commissioner Dennis Deere, Melva Brownlee. I'd also like to recognize Dr. Eric Makaitis, Interim CEO of Cook County Health, Dr. Tom Nutter, Chief Behavioral Health Officer, Cook County Health, Dr. Lamar Hasbrook, Chief Operating Officer for Cook County Health, Jennifer Brothers and Dr. Carlos Casada Gomez, who are representing the Office of Behavioral Health team, and Avik Das, Executive Director of Cook County Justice Advisory Council. We all know there's a mental health crisis in this country. As I said in March in this location, it's going to take all of us working together to make inroads. We know that people and organizations in the communities have the best insight into what is needed in their communities and how to go about making a difference. Standing behind me today are representatives from 53 organizations doing significant work in the behavioral health space, and we're excited to support them as they do that work needed to best support our Cook County residents. Providing financial support to these organizations helps us increase our touch points throughout the county, particularly areas with high rates on the Social Vulnerability Index. That's important to assure that these areas that have been historically underserved have access to resources that have not always been available to them. I'm thrilled to see so many organizations that are first-time recipients of grant funding from Cook County Health being represented here today. This initiative highlights how government and other sectors of our community can work together to benefit the greater good. This is an historic opportunity to make meaningful change in Cook County for generations. Now, Commissioner Casada, I'm going to introduce you next, and we're grateful that Commissioner Aguilar has joined us. So I'm going to ask you to introduce Commissioner Aguilar as you conclude your remarks. And Commissioner Aguilar, we asked that each person introduce the person who follows them. Thank you all.
Good afternoon.
Good afternoon.
Thank you, Madam President, for the kind introduction, and I'm so incredibly grateful to be here this evening, or this afternoon, for this historic investment in our county. As the President said, you know, our communities are suffering right now. There are so many people within our neighborhoods who need mental behavioral health resources. And to know that our county is playing a historic role in investing a historic amount in strategic resources that are going to be connecting all these organizations together and centralizing them and also moving them strategically toward healthier communities is something incredibly powerful and something that I'm very grateful to be part of. And I look forward to investing more resources in the years to come to ensure that this is a guaranteed investment and not just a short-term investment. So I'll leave it at that, and I also want to introduce Commissioner Frank Aguilar.
Thank you, Commissioner. Thank you, Madam President. You know, without health, you have anything. It includes mental health, and I'm glad that we're investing resources to folks out there who really need it. You know, mental illness is not. It seems to be affecting all walks of life. Doesn't matter if you're rich or poor, or regardless of races. And I'm glad that we're taking the initiative and making sure that our community benefits from this investment. So thank you very much for your leadership, Madam President, and the health, Cook County Health, for your initiative in reaching out to our community that's suffering and needs this help. And the next speaker will be, I can't think of it. Is it Avik Das, Executive Director of Cook County Justice? I'm way ahead of me. Eric Makaitis, the Interim CEO of Cook County Health. Thank you.
Well, thank you, Commissioner Aguilar. Good afternoon.
Good afternoon.
Today is a great day for Cook County Health as we celebrate 53 groups who will be receiving grants from the Stronger Together initiative. I'm grateful to President Preckwinkle and the entire County Board of Commissioners for entrusting us as stewards of these funds to help address the broad behavioral health needs we see across Cook County. I'm also thankful to the Cook County Health Board of Directors, who have been incredibly supportive of our audacious aspirations to develop and sustain a robust regional behavioral health network. The community-focused institutions awarded today will make a significant impact in expanding access to comprehensive, culturally appropriate behavioral health prevention, treatment, and recovery services. As a leader and convener in this space, Cook County Health knows that we are truly stronger together. When the Stronger Together initiative was announced in March, we wanted to ensure representation across the county and have various touch points across the continuum of behavioral health care. The needs before us are vast, as everyone knows. We have increasing demands for services across Cook County and a lack of mental health providers. At times, it can feel like the problem is too big. It was critical that we invest in services that are equitable, effective, and accessible for all. Looking out at the groups gathered here today, I'm thrilled by the diversity and the breadth of work represented. Today is a great day for health of Cook County and its residents, and I'm glad to see so many here to collectively celebrate that. Thank you. And it's my pleasure to introduce our Chief Behavioral Health Officer, Dr. Tom Nutter.
There are certain days you just know you'll always remember. Today is one of those days. Today, we get to announce the allocation of over $44 million in American Rescue Plan Act funds to organizations engaged in improving the mental health of Cook County residents, particularly those residents who live in disinvested communities. It is a great day, it is an exciting day, and thank you all so much for being here. First and foremost, thank you, President Preckwinkle. It is Madam President's vision and strong leadership that have made today possible. Thank you also to Commissioner Quezada and Commissioner Aguilar for being here today. I also want to thank each of the Cook County Commissioners and each member of the Cook County Health Board of Directors, as well as Cook County Health Interim CEO, Dr. Makaitis, for their leadership and support of mental health. The foundation for an exciting event like this is often in many unexciting details. So thank you in particular to Ms. Gibson and Mr. Thiessen for your mastery of those unexciting details. Much good has and will come of those efforts. Thank you to our team at CCH's Office of Behavioral Health. It's only been a few months, but it's clear you are amazing and continue to demonstrate it every day. It is an honor to work with you, and I look forward to being part of all that you, along with our growing number of community partners, will accomplish. Your dedication, skill, and collaboration give us reason to be confident that our role as conveners, coordinators, advocates, and leaders will not only continue to expand in the coming months and years, but will do so in ways that improve the behavioral health ecosystem, I'll use Jennifer Brothers' term, throughout the county. And speaking of Ms. Brothers, a huge thank you to Jennifer Brothers. I may be the one at the podium, but make no mistake, Jennifer is the architect and builder of the entire process leading up to today. To say that she has been a superstar would be something of an understatement. Thank you to those in every organization that applied for the Stronger Together grants. If you don't believe that there are heroes in the world, I wish you could have had the chance to see what I was privileged to read over recent weeks about the inspiring work happening throughout our county. Last, and certainly not least, thank you to each of the 53 awardee organizations here today. We at CCH are privileged to be able to provide these funds. We very much look forward to working with you, to being alongside you over the next 2.5 years, and we are thrilled at the opportunity we will have to learn from you. There is no question that the mental health needs within the communities we serve are daunting, but there is also no question about the resolve of those in this room to change things for the better. Onward we go. Thank you. And with that, I'll turn the podium over to my esteemed colleague, Dr. Lamar Hasbrook, who is Chief Operating Officer for the Cook County Department of Public Health.
Good afternoon, everyone.
Good afternoon.
So we are stronger together, but we can do little without committed leadership. So I want to acknowledge President Preckwinkle, the commissioners behind me, Cook County Health leadership for their visionary support with tackling this stubborn and growing public health concern. It is alarming that For instance, opioid overdose deaths are increasing at a rapid rate, and for every death, there are 10 times as many folks who are hospitalized for opioids overdose, a non-fatal overdose. It is true that Black youth have some of the lowest suicide rates, but despite that, they've shown the largest increase in the number of suicides by some staggering 80%. And based on self-reported surveys, suicide attempts among Black youth is 3 times higher than those of whites. It is no less troubling to hear that directly from our community partners like those standing behind me, school counselors and nurses, that there's increased concern about alcohol use disorders in school-age kids, increased concerns about bullying and violence, increased number of kids struggling with their mental health, especially since the COVID pandemic. And this is why it's so important to match the expanding challenges with expanding resources. And although this is unprecedented and historical in terms of the amount, $44 million, it's not just about the dollars. It's about the collaboration. It's about the visibility. It's about the partnership. It's about catalyzing what these partners behind me and so many others are already doing on the ground and in the field. Our community partners have shared positive stories from previous smaller investments. For instance, they've shared the story about the mom who received treatment for herself and her family members after losing a child to fatal violence. They've shared stories about the person who learned how to use naloxone to reverse opioid overdose deaths despite initially being very hesitant to learn. They've shared stories about the mentor who took the youngster ice skating and then to a cooking class. So we understand, and I have no doubt that this program and these funds and these community partners behind me and so many others will undoubtedly continue to amplify similar successes that we've seen in the past, will increase resilience, and will continue to fortify hope for our community. And with that, I want to introduce our next speaker, who is Dr. Carlos Quesada Gomez. Thank you.
Buenas tardes y bienvenidos. Soy el doctor Quesada Gómez de la Oficina de Salud Mental de aquí del condado. Y estamos aquí porque estamos asignando 44 millones de dólares para la salud mental del condado de Cook. Esta es una inversión en nuestras comunidades. A los comisionados del condado, a la Junta Ejecutiva del Sistema de Salud, al doctor Mikaides, gracias por su apoyo. Gracias especialmente también para la señora Gibson y la señora Thiessen por su atención a los detalles administrativos y a mis colegas del equipo de salud conductual, especialmente a Jennifer Brothers, por su liderazgo y su labor en esta área. A las organizaciones solicitantes de Stronger Together, sus historias son inspirantes. Sus propuestas reflejan mi experiencia y la solución como un inmigrante de México que vino aquí y creció al sur de Chicago, en la vecindad sur Chicago, y además por toda la experiencia que he tenido, 15 años trabajando con los detenidos de la cárcel Cook County, 5 años con un pueblo indígena en Arizona y con muchas otras organizaciones. He vivido y he visto que de veras tenemos que desarrollar un sistema de salud comunitario que sea más equitativo, accesible y que también sea basado a la cultura de todos los residentes del condado. Para estas 53 organizaciones galardonadas, felicidades. Estamos emocionados de trabajar con ustedes para lograr un cambio positivo. Aunque el camino es desafiante, juntos haremos la diferencia. Gracias a todos ustedes por su compromiso para mejorar la salud mental y abordar los problemas de consumo de alcohol y otras sustancias en nuestras comunidades en el condado Cook. Buenas tardes. And next, I'd like to introduce Avik Das, Executive Director of the Cook County Justice Advisory Council.
Gracias, Dr. Quezada Gomez. Good afternoon, everyone.
Good afternoon.
It's an honor to stand with President Preckwinkle, county commissioners, the leadership of our Cook County Health System, and representatives from the many impactful organizations receiving a grant as part of the Stronger Together Behavior Health Initiative. The name of this initiative, Stronger Together, is no coincidence. We cannot navigate the behavioral health crisis, let alone the crisis of gun violence, violence in our communities, or effectively address the needs of residents and communities without working together. We cannot build safer, healthier communities without the sustained efforts of so many diverse stakeholders working in solidarity every day to make tomorrow better than yesterday for the people of Cook County. Under President Preckwinkle's leadership, I have the privilege to direct the Justice Advisory Council. We drive many county policies, justice reforms, and investments in community-based organizations, all in support of our communities most historically impacted by violence and contact with the criminal legal system. The Justice Advisory Council administrates the county's Gun Violence Prevention and Reduction Grant Initiative. This investment of $110 million in American Rescue Plan Act funds supports the critical work of about 150 organizations in communities across Cook County that experience the highest concentrations of shooting incidents. Again, Stronger Together, it's no surprise that many of the organizations behind us today are also organizations that we get to support in the Justice Advisory Council. We administrate grant initiatives focused on addressing domestic violence as well and providing housing and wraparound services to people returning home from jail and prison. So I am proud to recognize and affirm and congratulate the investments announced today through the Stronger Together initiative that build on and strengthen the array of services funded across the Justice Advisory Council's grants portfolio. Insofar as Cook County Health makes these historic investments in behavior health, it serves to advance violence prevention work and ultimately helps make our communities safer. I cannot overstate the interconnectedness of violence prevention and behavior health, of centering the well-being of the whole person and helping people and communities recover from violence and experience more peace in their lives. Trauma-informed counseling, case management, culturally competent crisis care and treatment are part of a robust continuum of mental and behavior health services that effectively support the everyday safety and stability of our residents. The solidarity of purpose I highlight here with the Stronger Together initiative comes during Gun Violence Awareness Month, thus I wear orange. As a county, we come together to promote awareness and action towards addressing the impacts of gun violence and preventing community violence. Every time people benefit from the supportive services they need to best attend to their mental and behavior health, they and their community are better off now and for the future. These are the very kinds of service made possible through the Stronger Together initiative and the many, many great organizations on stage here today. The Justice Advisory Council is pleased to continue our close work with Cook County Health and Cook County Department of Public Health to coordinate our respective and complementary strategies for safer, healthier communities. Congratulations to the awarded organizations, and thank you. Now, without further ado, let's hear from some of these awardees. If we can bring to the mic Bruce Tyler from Alianza Americas.
Good afternoon, buenas tardes. My name is Bruce Tyler. I'm here representing my organization, Alianza Americas. We are a network of immigrant-led, Latin American origin community organizations and cities and towns throughout the United States. And we have a strong presence here in Chicago and Cook County as well. Since the start of the COVID pandemic, we've been working with a network, a growing network of community health workers, promotores de salud, who have been gathering together in monthly or bi-monthly meetings facilitated by me and my colleagues, in which we're talking to them and allowing them to share their own experiences about what it means to take messages of health and well-being to people in their community, and not just to take those messages, but to listen to the people in their community and learn from them as well. And in those spaces, then, they've shared with us what they've been hearing. And one of the things that they've been hearing, sorry, I'm speaking really fast, besides the question of COVID, is this question of mental health and mental well-being. It comes up every single time we talk to them. So when we had this, heard of this opportunity, we knew that we had to jump on it. And so we're very grateful to the people that are running this program in Cook County for recognizing the strength of our proposal. We are going to be working with member organizations here in Chicago and allies on a three-pronged approach. First of all, we want to make sure that all of the member organizations and our allies throughout the city and in surrounding areas of the county where we have some reach are aware of the resources that are available to them. And so we'll be working to gather an ongoing updated list of services and providers and making sure that they have this in their hands. But that's not good of much use unless they feel like they can reach out and talk to people in their community about the issues that they're facing. One of the things that we've also heard repeatedly is that while community health workers, promotores, have heard about issues and concerns about mental health and well-being, people in their communities are afraid to talk about it. They're afraid of being rejected, they're afraid of being misunderstood, and they're afraid of being mistreated by people that they seek help from. And so we're going to be working with our members and people in their communities on mental health first aid trainings and series of conversations, open conversations about different topics related to what does it mean to live in a in a state of mental well-being, and what are some of the problems that we face, and how can we maybe try to address some of them either internally or by seeking help. And so once we have the resources to do that, to seek the help, we have to feel comfortable doing it. And so that's the second part. The third part of our approach is to, through that process of listening to our community, then offer words back to the providers and to the institutions that provide that health about those issues that I mentioned at the start, which is feeling rejected, feeling misunderstood, and feeling mistreated. So because we hear and we listen to people all the time. So esos son los tres ejes principales que tenemos en nuestro trabajo, que es, primero, asegurar de que toda la comunidad sepa de los programas, de los servicios que están disponibles, que estén a su alcance. Número dos, que se sienten con la libertad y con el derecho, de buscar ayuda en esos lugares. Y número tres, informar a los proveedores acerca de lo que hemos estado escuchando de la gente de la comunidad, de los problemas que ellos sienten a la hora de buscar ayuda, para que no sienten el miedo de ir a buscar ayuda. So once again, thank you very much. Muchas gracias por el apoyo. Thank you for your support. And as I leave the podium, I would like to invite Dr. Hong Liu of the Midwest Asian Health Association to the podium. Thank you.
Good afternoon. Good afternoon. Honorable Cook County President Tony Preckwinkle, and your commissioner and your health team, distinguished guests, community leaders, and media friends, thank you so much for being here to share with us this happy occasion. Congratulations to all the grantees on the stage. Please give them a round of applause. First of all, I would like to thank Cook County Health Committee for selecting MAHA, Midwest Asian Health Association, for this grant award. I also want to use this opportunity to thank Tony Preckwinkle and your leadership team for your services to improve the health and the well-being of our community in Cook County. This grant, this initiative is very important to address the behavioral health needs of the underserved communities, including Asian immigrant communities, especially among the seniors, youth, and adults who have culture, language, and institutional barriers to healthcare. This grant will enhance and expand MAHA's capacity for early intervention and prevention, treatment, support, recovery for the medically underserved Asian communities. The demand for mental health and the substance use services is at an all-time high. The COVID pandemic sparked a mental health crisis. We are happy to be part of this Stronger Together initiative to provide coordinated, culturally and linguistically responsive services to the Asian immigrant community. MAHA is committed to addressing the unique needs and the challenges faced by our population in accessing quality behavioral health services through a comprehensive, culturally sensitive, and community-integrated approach. The Midwest Asian Health Association, MAHA, is a non-for-profit organization with a mission to reduce health disparities for medically underserved population in the Midwest. We provide culturally, linguistically appropriate health services in collaboration with community-based organizations, healthcare providers, government agencies, volunteers, academic institutions working together. We are the first Asian family center in Illinois. We are also the first food pantry center in Chinatown. We have a state-licensed mental health clinic and the first licensed substance use clinic in Chinatown. Our employment program serves people with mental health and other disabilities. Our Navigator program has served thousands of people to apply for health insurance and other benefits. We have a health screening, immunization in collaboration with the CDPH. We have a free hepatitis B clinic to identify and treat hundreds of patients with hepatitis B and liver disease. We also serve youth through our summer youth program and the summer employment program. This grant is critical to support us to continue our efforts to bring about a positive impact on the health and the well-being of our community in Cook County. Thank you so much, and I'm so excited about this grant, and I look forward to working with the Cook County Health team to improve our health and the well-being of our community. Thank you so much. Now it is my pleasure to introduce Kamasha Jones, Sister of Fire Community Health, to the podium.
Good afternoon. Good afternoon. I'm just so grateful to Cook County Health, the commissioners, and everyone who's been a part of creating Stronger Together, this opportunity that will increase mental health accessibility across the county. So I'm just so grateful to you all. So just a little bit about myself. I am the executive director of Sister Afia Community Care. We were founded in 2020 in the midst of the pandemic to respond to the mental health inequity impacting Black women across the city. Contrary to what's often carried throughout the community and in the media, that Black people didn't want to engage in mental health care, we found that Black women were very interested in engaging in mental health care, but it had to be provided in a very specific way, and cost was the major barrier. So our organization provides free mental health care to Black women. We specifically focus on the south side of Chicago because of the lack of providers in the area. And also, we believe in providing a wraparound approach to supporting the mental well-being of Black women. And since we were founded in 2020, we've already served over 1,000 Black women. And with this investment from the Stronger Together grant, we intend to serve thousands more. So some of the services that we provide that will be enhanced because of this investment is our Heal Together, which is the first peer support program for Black women, where people can receive emotional support and also are able to receive connection to resources. We also found that women who would come to us for therapy experience multiple barriers and sometimes things that were going on outside of mental health that related to stability needed just as much of attention. So we will be hiring additional case managers to provide support outside of therapy that can help with stability and to help women to thrive. And then lastly, one thing that's so special about Sister Afia Community Care is our support in terms of providing a wide array of opportunities for Black women to heal, connect, and grow together. So that comes through our monthly wellness classes, our groups, our retreats, our workshops. We want Black women to know that they can lean on one another and that they don't have to go through what they're experiencing with their mental health in isolation. So through this investment, we'll be able to deepen our support, deepen our impact, and be able to expand. I believe that mental health care is one of the most important issues facing our country right now, and I'm proud to be in a city and proud to be in a county where mental health is a top priority. So thank you.
All right, thank you. We've been joined by Melva Brownlee, who is on the staff of Commissioner Dennis Deere. Would you like to say a few words?
Good afternoon, everyone. My name is Melva Brownlee, and I have the privilege of serving as Chief of Staff to the Honorable Cook County Commissioner Dennis Deere of the 2nd County District. He sends his regards for not being able to join us on today. He also serves as the Vice Chair and member of the Cook County Health Board. We would like to personally thank you, Madam President, for your leadership, for your visionary leadership that you have provided to Cook County government, in particular in the area of behavioral health. Commissioner Deere is a staunch supporter of behavioral health. Being a licensed trained psychologist for over 25 years, he has dedicated his life mission to this work. The $44 million initiative that's been provided through ARPA funds will go a vast way of services to providing services to our community. As we know, there is a stigma behind mental health, behavioral health services, but the people that stand behind me that's on this dais is doing the work that we so desperately need in our community. As we can see through collaborations and partnership with community health leaders, community-based organizations, faith-based organizations, we truly are stronger together. We truly are Cook County government, and thank you for your commitment in the area of behavioral health. Congratulations to all the recipients.
Thank you.
Dr. Pierce.
All right. Dr. Pierce, where are you?
All right. Good afternoon, everyone. Good afternoon. My name is Dr. Mario Pierce, and I'm the Senior Director of Programs at Brave Space Alliance in Hyde Park. Brave Space Alliance is an LGBTQ+ center located on the south side of Chicago in Hyde Park, and we serve all people, okay, so we're very inclusive. We focus on HIV testing and counseling, housing readiness models, a community pantry, support groups, and we're ramping up a mental health program, okay? Thank you all for allowing us, Brave Space Alliance, to be a grantee of the Stronger Together initiative. We will be working to provide culturally competent and responsive awareness services around mental health and behavioral health, including substance abuse, for a population that is often left out. which is the house and ball community. We will be focusing on the leaders within the house and ball community to help develop future leaders. There is a significant challenge and problem within the house and ball community with regard to substance abuse. We need this initiative, and we, sorry. Oh, sure, okay. All right, thank you. All right, so yes, so the house and ball community is a part of the LGBTQ community, okay? And so what happens is we have organizations that come together that compete at events called balls. So if you've ever seen the show like Pose or Legendary, okay, that references the house and ball community. And house and ball community becomes families for those, chosen families for people that may not be so close to their family or ostracized by family, okay? So mental health challenges have been ramping up in our community. Substance use is ramping up, and so we need support and just services to help support our community. That's it. Thank you.
Thank you. Before we take questions, I'd like to thank Michael Albert and Diana Thorpe, who are our sign language interpreters. Nick?
Any questions in the room? Any reporters with questions? Once, twice? All right.